Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. For this video of the Knee to Know Show, we're going to talk about elective surgeries, which knee replacement surgery falls under that umbrella, and we're going to talk about the impact of the COVID-19 virus on elective surgeries in general, and in particular on knee replacement surgery. So I wrote down, did a little research, did a little thinking of the top couple things that I think are going to be expected, are going to be seen when it comes to elective surgeries and knee replacement surgery, or elective surgeries and the impact of COVID-19. So, of course, as many of you know, with the COVID-19, with the shutdowns, with the quarantining, the isolation, social distancing, the majority of hospitals throughout the country, and I'm guessing in a lot of different countries besides the United States, I don't know exactly, but I'm guessing in a lot of different countries that elective surgeries, what they call elective surgeries, are basically being postponed. And so what this means is things like knee replacement surgery, hip replacements, other things probably like a lot of common shoulder surgeries, rotator cuff repairs, labrum repairs, all sorts of different surgeries can really fall under this umbrella term of elective surgery. Basically, one way to look at it is any surgery that if you don't have it right away, it's not life-threatening, it's not threatening to your health overall. It may be painful, it may be a real burden, it may be something that really has to be taken care of at some point, but it's not something that if you don't have the surgery now, or if you don't have it within the next couple weeks or months, it's not going to be a risk of, a health risk to your livelihood and anything serious of that nature. So that's kind of what elective surgeries are. Of course, vast majority of the time, knee replacement surgeries are going to fall under that list. There probably are some situations with maybe an infection, revision type surgeries, or someone has such a significant deficit or impairments, maybe some mechanical issues, alignment issues going on where they may need the surgery right away. But most times you're going to fall under the elective surgery. So what are some things that we can expect moving forward? Well, one thing for sure is there's going to be definitely a big, long wait list when it comes to these elective surgeries. Think about the people who wanted to have elective surgery in March or February. Probably March is probably when they really started to cancel these surgeries. So March all through April, all the people who had these surgeries scheduled well out in advance, and now they're postponed. So now you're adding those people to the people who had surgeries in May. There's no guarantee that these people, even in May, they'll be able to start fully doing elective surgeries. There's still a lot of things to consider. I know they're slowly starting to get back into it. So you're going to expect a long wait list and potentially having to wait a very, very long time till you get to actually get to have your surgery. If that's a matter of months, if that's a matter of maybe a year, a couple years, I wouldn't be surprised by that. And that's something that you need to prepare for mentally, physically, have that conversation with your surgeons, have that open dialogue. Something to keep in mind as well is I definitely wouldn't be surprised if individuals are going to start seeing, maybe they start getting back to elective surgeries, they give you a date out in the future now that your surgery has been pushed back to. I would not be surprised if you see future additional delays, additional postponements. Again, the coronavirus, this is something that is very new. It's going to be one of those things of opening things back up and then increasing the social distancing and then letting off a little bit and then increasing it. There's the risk of having second waves of the virus coming through. So there's going to be this very prolonged kind of touch and go period for the next probably a matter of months to next year or two at least. So it's very possible that there may be a period of time or multiple periods of time within the next year or so where there's another significant delay, either stopping elective surgeries or stopping a good significant portion of elective surgeries. So again, another thing, even though you've gone through this postponement, it might not be the end of the road. Keep an optimistic outlook, but be aware that worst case scenario might happen where it might get delayed again and there might be additional postponements down the road. Again, who really knows, but something to keep in the back of your head. Another thing is you want to think about the actual experience of having the surgery. So, there's going to be a lot of changes. There's probably, you're probably going to be going to the surgery by yourself. A family member drops you off and then picks you up after surgery and after your discharge. There's probably going to be a lower overall capacity in these places. So people who have to stay post-op, either for a number of hours or stay overnight at the hospital, they're going to have these different strategies, these different things to maintain that social distancing, to maintain that separation so there's no spread of anything. So you can expect probably, they're not going to be operating at full normal capacity. You might see half a capacity, you might see 2/3, just to keep that spacing between individuals and keep some of the busyness of the operating rooms down so that spacing, distancing can happen. Other things you might expect is that prior to your surgery, you might have to go through and have a COVID test performed, see if you have the active infection or not. I would not be surprised if that's part of, they're doing it with individuals with pregnancy now coming to the hospital who are pregnant, giving birth, having them take COVID tests, determine what's going on. You might be wearing a mask when you're in and out of surgery, things that are very possible and very probably likely to see. A couple other things is there's probably going to be this growth or this increase in the number of surgeries that are performed on an outpatient basis. So typical standard total knee replacement, you always had that couple day stay in the hospital afterwards. That trend has already been going toward more outpatient same day surgeries, ambulatory hospitals or centers where they're coming in for surgery and you're being discharged home the same day. I can see that being increasing even more, less time in the hospital, less time surrounded by people. So if people who are appropriate for that, I think there's going to be an increase in the amount of surgeries that are going to be these same day outpatient type of knee replacement surgeries. And on that same line, I think there's going to be a lot of discussion of optimizing and making discharge planning extremely efficient. So no longer is this, you have to stay 3 days. If you're someone who's appropriate for discharge same day from surgery, then they're probably going to push that. If you're somebody who, they're really going to try to get you home versus going to a skilled nursing facility, going to a subacute rehab facility, let's get you home. Let's maintain that social distancing. Why take you to a facility where there's a bunch of other people if we can avoid it? You're going to see probably a lot more of this telehealth. So both in terms of your follow-up appointments with your doctors, with your surgeons, you're going to probably see a lot of those happening through telehealth if possible. Physical therapy services, I think that, there's still going to be your traditional outpatient physical therapy, going to a facility, going to a physical therapy clinic. But I think there's going to be more of this kind of mixture, more of this combination of part of your rehab is going to the outpatient clinic, part of your rehab is doing telehealth visits. So maybe going to the clinic once a week or once every other week, and then that second visit or third visit, doing it maybe through a telehealth service. just to maintain that social distancing, that isolation, less crowded, less busy physical therapy clinics to help avoid the spread and maintain that social distancing. So those are probably the top 5 or 6 things that I really see happening moving forward when you look at knee replacement surgery and elective surgeries and the impact of the COVID-19 and everything that is coming from that. So if you have any thoughts about that, if you think that there's anything else that I missed, I'd love to hear your questions. I'd love to hear your see your comments. Please share below in the comments if this was useful, if this was helpful for you. I'd love to hear that too. I think the big take-home message is you have to have the mindset. Have the mindset is hope for the best, that hope you can get your surgery and it's successful and you can get in and get out. But don't prepare for the worst. Prepare for possibilities of being on a long wait list, having further delays. These things can happen, and you want to prepare for that both mindset-wise, mentally, psychologically, so you're not experiencing this depression, this frustration, this negativity, but also you want to prepare for that physically. So make sure that you're doing what you can physically to manage your symptoms. Are you maintaining healthy weight or trying to lose some weight if that's appropriate? Are you trying to stay physically active or do some exercise on a regular basis? The more that you can do and manage on yourself, the more exercise, the more you can stay active, the more you can do stretching and range of motion activities, the better your outcome from your knee replacement surgery is going to be whenever that time comes. And if you're really good and really work hard, in some instances, you might even be able to avoid surgery altogether. So that's something to keep in mind too. Not the case for everyone, but definitely is possible and can happen with just conservative treatment and conservative management. So thank you very much for watching, everyone. This has been the Knee to Know Show. I'm Dr. Luke Peterson, physical therapist with the Knee Replacement Therapist. I'll catch you all tomorrow with some more information and videos.